Hello and welcome to week 7 of NUR1000. Next week will be week 8, which is halfway through the semester. First, we're going to briefly review some of your week 6 assignments. You did a discussion board posting about burnout, where we are exploring burnout because that is a problem that many nursing students experience, and then many nurses, especially bedside RNs, experience burnout in their profession as well. So it's important that we think about burnout and sort of identify if we're feeling that way and identify some strategies to deal with burnout, both in nursing school and once we become registered nurses. Your week 6 activity had you looking at in your textbook and finding some of those strategic words that you're going to be looking for in NCLEX style questions. Words like priority, immediately, most important, needs more instruction, things like that. They give us clues as to how to properly answer those questions. We're going to be really getting into some key test taking strategies in the next couple weeks. So recognizing those strategic words will be very important as we go on. And it's also important when identifying which test taking strategies to use. Next, you had to sort of break down when you get a multiple choice question, you get down to the final 2 answers, but you can't pick how do you decide the correct answer. And it boils down to really rereading the question and rewording it, including any strategic words and understanding what's at the heart of the question. Using your clinical judgment, reading over the answer options again, eliminating them if they don't apply, and then make your final choice by focusing on what is the question asking. Don't include any of those what ifs or but ifs. Using your nursing knowledge and implementing the test taking strategies that you'll be honing in during this course. Finally, we talked a little bit about what if syndrome and how to stay away from asking yourself what if or but if when taking NCLEX style questions. This needs to be avoided because it leads into reading further into the question than needed and can throw you off track of what the question is actually asking. And that was a student response, and that was spot on. So don't ask yourself what if or but if when answering NCLEX style questions. You completed your first 25-point quiz for NUR1000. The grades for all the week 6 assignments will be posted by the end of the week. And lastly, we'll look at our week 7 expectations. So this week you're expected to read chapter 7 of your textbook. You'll have 3 recordings this week 7 greeting, a week 7 recorded lecture about positive and negative questions, a little bit about imposter syndrome, and 2 specific item types, select in and grouping. And then you'll also have a recording about imposter syndrome. Your discussion board post will be about imposter syndrome. Be sure to only post things that you're comfortable posting. So if it feels like it's too personal for you to post, please don't post that. You can give examples that you've seen in anonymous friends and family. You don't have to post anything that makes you feel uncomfortable. The activity then is week 7 practice questions. That wraps up your week 7 expectations. Remember, discussion board initial posts are due by Wednesday at 11:59. Peer responses and all other assignments are due by Sunday at 11:59. And going forward, you won't receive any reminders about those. So make sure you have them on your study calendar. Good luck with your week 7 activities.